understanding emotional well-being. Welcome to this module, which will introduce emotional well-being. The term well-being is popular in day-to-day language. However, the definition and the key features of this term are not well understood. This module will help learners to understand the difference between health, mental health, emotional well-being, and the characteristics of each term. Furthermore, learners will delve into how emotional well-being, physical, and social health are linked to each other. Once the learner has a clear understanding of what emotional well-being is and the influence emotional well-being has upon physical and social well-being, the module will prepare learners with practical strategies to help manage and maintain emotional well-being. By the end of these lectures and the workbook, you will be able to understand the importance of emotional well-being, understand the difference between emotional well-being and traditional views of health, understand the concept of resilience, which can be used to manage difficulties, understand the factors that have a positive impact on emotional well-being, and understand some strategies to manage emotional well-being. This module has a logical format and covers 5 units. This first session is an introduction and will set the scene for the forthcoming module. This current session will outline the current landscape around emotional well-being and provide a justification for this module. It will also outline the requirements for the embedded RSPH qualification and the associated assessment procedure. The subsequent units will cover each of the 4 learning outcomes mentioned previously. The learner journey will move from understanding why this area of study is important, understand what the core concepts are, and progress to understanding how emotional well-being influences overall health and how to manage and support emotional well-being. Mental health is very much like physical health. We all have one, and it is not static. This means your mental health is not fixed and is consistently under strain and flux at any given time. The way we think, feel, and react to situations is the cornerstone of our mental health. Much like physical health, it requires a concentrated effort and input to avoid factors that may negatively influence it and engage with elements known to positively impact it. When we say mental health, each individual will have their own interpretation of this term. In general, mental health tends to be a more clinical view of the emotional and psychological patterns that can be routinely recognized by a practitioner. A broad distinction between mental health and emotional well-being is to think about mental health and mental illness as noticeable changes or distortions in thoughts, behaviors, and feelings, whereas emotional well-being is a subset of this, which deals with people's ability to cope and function within their environment. This definition sets out that good well-being is when we can cope with or avoid extremes, as it impairs one's ability to maintain good functioning. Emotional well-being is not just about being happy all the time, but about your ability to function. Functioning refers to emotions such as achievement, engagement, belonging, and resilience. Being happy all the time is A, not possible, and B, would ignore the value of other emotions when they would be useful, for example, sadness following a misfortune. Emotional well-being is about people's experiences of their lives and is more than the absence of mental health symptoms. We need to be aware of the need to support the positive elements of mental health, which is where emotional well-being plays a vital role. Just because someone does not have signs of depression, for example, does not automatically mean they have good well-being. They are linked, but do not work in unison. To promote the positive emotional well-being side of mental health, there is a need for humans to feel life has a purpose that is manageable and coherent. The opposing positive and negative views of mental health provide a continuum or spectrum in which people will scale throughout their daily, monthly, and yearly trials and tribulations. Notably for those on the end of the emotional well-being, where they feel like they belong, are flourishing, and have good relationships, there is strong evidence for fewer diagnoses of clinical mental health illnesses, which strengthens the need to support the positive elements of mental health. Globally, more than 1 billion people are affected by mental health issues. Annually, 1 in 4 people will suffer from a mental health issue that is of clinical significance. The knock-on impact of this is staggering including levels of substance misuse, suicide, and other associated illnesses. Moreover, the stigma of mental health, people's own beliefs about their mental health, lack of access to treatment, and failure to seek treatment means these figures may only tell some of the story. There is a radical shift needed in how we view emotional well being, and there is a need to prepare people with the knowledge, skills, and opportunities to prevent the poor mental health side of the spectrum while enhancing the positive aspects of mental health. If emotional well being relates to the functioning of people and the feelings of belonging, life, purpose, achievement, and flourishing, how can we foster this when life gets difficult? One branch of science which has a role in this is emotional intelligence. The way we think, feel, and behave are linked, and therefore, the awareness and management of emotions plays a key role in decision making and responding to stressors. Emotional intelligence is about your capacity to recognize emotions and use them to assist reasoning within situations. Just like understanding what skills and practices are needed when thinking about how exercise can support heart health, understanding the skills of and practicing emotional intelligence may be useful in making your mental health more robust. In one well known model of emotional intelligence, there are 4 branches of core skills. Perceiving skills relate to a person's ability to identify emotions in themselves and others, express emotions for their needs, and be able to see honest and dishonest expressions of emotions. Using emotions to facilitate thinking, judgment, and memory is the next important skill. Thirdly, the ability to understand emotions and the causes and consequences of different blends of emotions is important. Lastly, the ability to manage emotions and be open to engaging with emotions is useful. It is beyond the scope of this module to explore emotional intelligence as a practical strategy to enhance emotional well-being. This taster sets the scene about the characteristics of emotional well-being and the foundational skills that are useful to prepare the learner to enhance the positive aspects of mental health. The assessment for this qualification involves a workbook. The workbook has a range of tasks and case studies that require you to demonstrate your knowledge across the learning outcomes. The task book has associated readings, self-reflections on learning, and discussion forums, which you will be required to complete. Once you confirm your completion of the workbook and supplementary tasks, you will submit it through your online learning portal within 6 weeks of completing the online learning. In summary, during this session, you were introduced to the qualification and its content, provided with a background to the course, and introduced some core concepts. Lastly, you were signposted to how the qualification will be assessed. I hope you enjoy the module and wish you luck in the future.